Well, welcome everyone. It's very nice to see you back here, or if this is your first day back on the series, welcome. Um, Today we are continuing our webinar series on Indigenous Milk Medicine, our celebration all week. I'm on meeting. My apologies, it is summertime, so I do have some wildlings running. I'm on a meeting, baby. I'm on a meeting right now. Sorry. I'm so glad that you could join us today, and we have a really special guest. We have Inez Louis is her English name. Lhaltanot is her home or traditional name. She is an RN. She is currently with the FNHA, and I will let her introduce herself and her role if she pleases. She's also a community member with a lot of breastfeeding experience, and on a personal note, a champion that I look to on my own breastfeeding journey, both for information and inspiration, and sometimes just because you need a safe space to have those conversations. So I'm going to turn it over to Inez. Welcome.
Thank you, Tony Kwasai. Asiam Tesiaya, Lachalta Natalskui, Talitskwasko Kale, Samath, Masquim Tunwasanabing. Good afternoon, everybody. My Holmachskui is Lachalta Nat. My English name is Inez Louis. I am from the Point family and Gosselin family here in the Skokiel First Nation, my home village, which is in the unceded Stalo territory, and where I work as well for the FNHA. In my role, I work as the clinical quality manager with the provincial team of the FNHA, and I am a registered nurse. I'm a mother, I'm a wife, I'm an auntie, I'm a niece, so many good things. And I'm so honored and humbled to be here with you today. Today, invited to share with you, and thank you, Tony. I just want to acknowledge that we are people first, and you're a mother. And sometimes in our work environments, we're asked to show up as if we aren't those things. And I think that there's honor in that we are family-oriented people, and hoping to share a bit more about that in my journey today. Happy to open up the chat if there's any questions or comments as I'm sharing. I have a little bit of storytelling to share with you today about my personal journey as a registered nurse, as an Indigenous woman, and as a breastfeeding mother. So I feel very privileged to have grown up in the Stalo territory in my village here. My father is Stalo, and when my grandfather on the Point side, who is originally from Musqueam, which is the village at the mouth of the Fraser River, was sent away to residential school, he came back home and both of his parents had died of tuberculosis. So he was sent upriver to the Stalo territory to live with his granny, and she had remarried a gentleman named Dan Milo, who was here in Skokiel. And so in an arranged marriage, my grandfather was married to my grandmother, Rena Point Bolton, and they started their family here in Skokiel and had 10 children and helped to raise many, many folks. As for those of you from community, you know that we take in people, we care for them, and that's why my grandmother always references that. And so as our family grew, my dad being one of 10 siblings, you can imagine how many cousins I might have. And so there's always children around, always babies being born. Very thankful that some of the practices that our family has is that we do, for lack of a better term, a baptismal in our own way. And it's a way that we bring the babies out and introduce them to the world, introduce them to the spirit. And so as a young woman, I observed how child rearing was expected of us. And my grandmother, as the matriarch, was quite strict with what she expected of us as the children, but also as the new moms. One of the things that we were to do as soon as we were able and discharged from the hospital was to bring our newborn child to our grandmother so that she could speak the language to them. And one of the things that she would do in the language is ask, "Who are you? Who are you? We know you're our relative coming back to us from spirit world. Who are you?" And it's been amazing to witness the babies coo and respond to her, "Oh." And it's been so interesting and amazing to see these practices that I grew up watching and thought were the norm. And so with breastfeeding, that was one of the other norms that was expected of us as the women and the aunties, my grandmother. And I even remember at one point my father checking with me, "You will breastfeed, right?" And it wasn't really a question. It was, "I'm checking to make sure you understand that that is our way, that is our traditional way of how we feed the children." And at this point, I had already gone to nursing school, and I was like, "Oh, yes, I'm of the best, breast is best crew." And so it was curious to me during that time at nursing school, this dialogue. So rewind back to going to nursing school, there was a curriculum talking in the maternity section where we learned about hospital, we learned about teaching breastfeeding, the latch, supporting, doing the education, and I thought that was wonderful. And I didn't really understand that engaging folks in breastfeeding was an issue in our community, because the norm that I had grown up as a young woman was that everybody was expected to breastfeed, everybody was supported to breastfeed. There was always space and time for the women to breastfeed. And so I went in my maternity rotation, and was shocked to see when women chose not to breastfeed, or they would make comments like, "I don't want to show my breasts. Why would I do that?" Or some of them had body shame. And so this was a good learning for me, that I think I had these biases and that I had these experiences that were so different than so many other folks and cultures. And then later really coming to understand, I wonder how the impacts of residential school and things like that had impacted our rates of breastfeeding. So I had graduated, done a year at bedside at St. Paul's in an unrelated post-operative surgical care, and was phoned by my nation, and they said, "We need you to come home now." And so I started to train as a community health nurse, and I was trained by my aunt, who was the senior nurse at the time. And part of my role there was to work and do the discharge planning with the moms coming home from hospital. And then, of course, we did the CPNP program where we coached the new moms to healthy eating, promoted breastfeeding. And again, it was a learning for me, realizing how many women had not considered breastfeeding and how many women were pre-contemplation, really, you could say. And so I was thankful for those conversations, and I began to get curious about, well, ask questions like, "Well, tell me more about why you wouldn't breastfeed," or "Have you seen people breastfeeding before? How do you feel about that? How would you feel about exposing your breasts to feed? What would that cause your body to feel like?" Because I was curious to know if there was some healing that might need to happen for those women. And if the partner was present, asking them, "How do you feel about that?" And you could see this discomfort. They had never broached this conversation. And I realized, I think up until that point, this bias that I'd held based on my experience of being immersed into a breastfeeding forward family, which really, I wouldn't even consider it that. It was a carry forward of the cultural expectation of the family, that was a privilege. I have to admit, I had a bit of a crisis about that also as a nurse. I was like, oh, this is a huge loss of culture. And so started then to incorporate into my nursing assessment. Have you had a conversation with the people in your family about breastfeeding? And then encourage them to go away and ask the aunties, their parents or grandparents or people that they trusted, what were the teachings that their families had? Because as we know, teachings aren't necessarily nation-based, they're family-based, family system-based. And so this was really encouraging to visit on the following CPNP visit, where they would come back and share, oh, I had a chance to chat with my auntie, and she said she didn't feel good about breastfeeding because of her experience, but she encouraged me to try. And so it started to open up conversations in the nation about what is the root behind the choice to breastfeed or not breastfeed. And this was a great segue into finding out, well, if your choice is not to, there's always the option if you change your mind. And there were folks that did eventually change their mind. I think sometimes we focus so much on the nutritional piece, but also there's so much culture to uphold. And then relating that as well back to some of the introduction of the newborn, what are the protocols and things like that, and that breastfeeding and breast milk are only one piece of that. And what was interesting is that there was a growing movement with the local Chilliwack public health unit about breastfeeding, and as well food introduction, traditional foods and whatnot. And I had had my second child, and they had offered us a little t-shirt, and I can't remember what it said, something about breast is best, or I'm a breastfed baby. And we took a picture of her, and they asked if they could share it. And I said, absolutely, if we can have more Indigenous representation, I'd be happy to offer that. So that was my experience as a community health nurse. But the disclaimer is, at that point, I hadn't had any of my own children. And I was acutely aware of that here I was as a practicing community health nurse, promoting breastfeeding, sharing my cultural knowledge from my family and encouraging other folks to seek that knowledge from theirs, but always coming with a disclaimer that I'm not a parent, and I wonder how they can lend their experiences to support other people or carry this conversation on about breast milk, breastfeeding, and to build this body of knowledge in this sort of natural grassroots-based conversation. And so I went on to have my own children. I have 3, and my breastfeeding journey was different with all 3. I think in reflection, looking at how the deliveries went, I realized how much trauma I carry in my body and how it presents itself. I had failure to progress in my first delivery and went to C-section, and I now reflect back that it was my inability to allow my body to do what it needed to do, as my grandmother would describe, that your body knows what to do and your spirit knows what to do, and you have to allow that to happen. But I was very fearful the first time I delivered, and I struggled to get a latch with my first child, my son. And of course, the standard procedure of when we're reteaching the latch and your nipples are getting raw and we're teaching to use lanolin and these different things. And I remember having this crisis as a community health nurse thinking, why can't I do this? And I realized I'm on a journey of one of my own patients. And this is a teaching for me to understand really how difficult it is and how difficult it can be, the sleep deprivation. I know at a certain point in sleep deprivation, you start hallucinating. And really trying and being so committed to breastfeeding. We eventually figured it out with my first child, and we breastfed for a year, which that was my goal, to align with the CPNP program recommendations. And I was so thankful for that. But it was extremely difficult for me. And so that was a really helpful experience and helped to inform my practice. With my second, by that time I had stepped away from nursing and started touring as a performing artist for music, and I would promote health careers, finishing school, and sing music, which was a part of my own personal healing. But I always carried with me that I was a nurse and a community health nurse. And wherever I traveled, I mostly traveled to Indigenous communities. I always wanted to meet the nurse there and talk about programming. What is breastfeeding like in your community and why? And better understand the nuances that impact the rates. And it was so interesting. I believe I was in Bella Bella, and they had invited me to do a morning presentation and a performance. They were having a pancake breakfast, first day of school. The RCMP were there doing the pancakes. It was everybody, all hands on deck to celebrate the beginning of the school year. And my aunt, my late Auntie Gigo, had traveled with me as my caregiver for my daughter. My children traveled everywhere with me when they were breastfeeding because they needed the breast close by. So there wasn't really a quiet place to bring the baby. And so they had her tucked away in the equipment room, which is sort of on the side of the gym. And partway through the presentation, I paused and said, I'd like to ask my Auntie Gigo to take a step out, and I want to introduce her. She's here with my daughter, and my daughter is a baby. And everyone clapped and said hello. I said, my daughter's here with me and traveling with me because she's breastfed. And so my baby needs to come everywhere with me so that I can breastfeed her. And there was a woman in the back that just went, yeah, in the crowd. And I said, and there's your community health nurse. And so it was interesting because afterwards I chatted with her and she said, I am the nurse. How did you know? And I said, because I'm a community health nurse too. And I realized that you loved that message because you've been feeling like you're screaming it into the void. And she said, yes, I am. And she had explained to me that their breastfeeding rates were extremely low. And my heart sank. And she said that's quite common here. It's quite common in most places. So again, that realization about how I didn't realize how it wasn't the norm to be exposed to this mandatory breastfeeding mandated by our family, even the men. And so I really got on board with talking about it wherever I went, wherever I toured. And so hopefully sharing that squawk-qual, or as we say in our language, that good news of what is helpful, because I know for me, if I can make a connection to my worldview, my belief system, the teachings of my elders, that's helpful for me. And so the things that helped for me to feel supported when I was traveling the most was my family, and that privilege to have my mother at my bedside, my father checking, making sure you're breastfeeding, accommodating me in his own ways, but then also knowing that I didn't have to be fearful of sitting down in a public place or at another family member's home to breastfeed, and that nobody would be questioning me about what are you doing. I was questioned quite a bit for breastfeeding when I was traveling outside of my community. I remember one time when I had traveled for music to Alberta, I was in a community in Siksika, which is a Blackfoot community, and we have family friends there. We were looking at one of their cultural centers, and they had a bench outside, and my daughter was crying. And so I wanted to console her and latch her. And so I pulled my shirt up, undid my maternity bra, and latched her right there in the bench in public. And my friend had a meltdown and said, what are you doing? And I said, what do you mean, what am I doing? I didn't clue in that she was questioning that I was breastfeeding. And she said, nobody does that. I said, well, I'm doing that, and I'm asking you to be okay with it. And it was the first time I really felt that I had to stand my ground. And I think a big part of my life, I had want to always make sure that I was being respectful, honoring, especially as a visitor in different territories. But I felt confident to not tap into any body shame that I was struggling with, knowing that I was putting my child first, and really invite my friend to support me. And I acknowledge that I think you feel uncomfortable that I'm breastfeeding, but this is natural. And I'm going to ask you to take a deep breath and just, if you're uncomfortable, like maybe you can go for a walk while I'm doing this. And so finding that confidence and strength not to be angry, but also inviting people to support in ways that they felt comfortable was an interesting journey for me. I had to decline outings. I remember one time we were in Quebec City. I had a contract with Inspire. And Zara, my daughter, was cluster feeding like crazy, and we didn't leave the bed all day. And so we had to decline an outing because I said, sorry, I can't join. We've had a busy travel day and she wants to be on the breast, and she was going through whatever was happening, cluster feeding, growing, needed the comfort. And so I always felt supported by the friends who could understand that my priority was my child, and that were willing to learn and listen about what that journey was like. Special shout out to the folks who delivered food, made those special deliveries. I do feel like in traveling, there were waves that were made, sometimes shocking more than others. The one story I'd like to share with you was there were a set of awards, and I'm not sure if everybody remembers. APTN had done a live televised show for Indigenous music, and there were awards that were done at it was a big stadium in Winnipeg, like where the hockey games are played. And it was my first time being on that show. I was very nervous. I had had a custom leather dress and bustier made, and I was breastfeeding at the time. And so you can imagine, as my milk came in, I became very uncomfortable. And the bustier top that I had was, you can't take it on and off. And so I figured out a way to just pull the whole thing down. And with a blanket or something, I just had to figure out how to cover myself. So at least it had easy access. And so I was busy with rehearsals. I was in this outfit, and my mom had come with me. And finally, she came to me and she said, he really needs to eat, and you need to do it now. And so I'm looking around, and we were in a green room where all the artists are sitting, and there was rappers over here, and there was all different kinds of people. And so I thought, what am I going to do? I also need to be comfortable. And I wasn't comfortable being in that room, aware that not everybody may be as supportive as I hoped. So I walked down a little hallway and was looking for a private space, and I found this big room with the couch. And so I thought, okay, I'm just going to feed him in here. And he was crying. So I just pulled my whole top down, and finally he latched, and we were both, centering, connecting, finding that lovely space that you have with your child. Not a few minutes passed, and a few people started filtering in the room, and they looked at me with intense curiosity, and then shrugged and walked away and carried on what they were doing in the room. And more and more people came in, and I thought, what's going on here? And then finally Buffy St. Marie came in the room, and she looked at me with the same curiosity and was like, okay. Apparently it was Buffy St. Marie's private dressing room that I had crashed, and she was the headliner for that event. I later went to apologize to her because I didn't realize this was her private space, but she is pro breastfeeding herself, and thanked me for knowing that that was a safe space that I could come. Really, I didn't know it was. I know there's a lot of controversy about her and her identity, but that's a story I have from before that controversy came to light. So I always like to share that story, that I was so committed to breastfeeding that I tore my shirt off and fed my son in her dressing room. So with that, I think that as providers, I often reflect now in my role as a mom, and I think in the future, a grandmother, an auntie, as a nurse, how my experience and my learning can inform my practice now. how I can share those teachings forward with my nieces and explicitly share it with them, to be curious about traditional teachings about breastfeeding, ask them to be champions, to support folks to have choice based on their comfort level, because we know everybody arrives to parenthood with different places in their healing, but also to make sure to remind them, is that a goal for you? And what is your goal in parenting? And wondering how breast milk plays a role in that. And being mindful to know that even with the goal to provide breast milk to your child, that they may get breast milk in a way that's different than what we expected, because we know moms may have to source breast milk from other areas. Even in our families, which I know from a clinical practice perspective is frowned upon, there are many times where we would feed each other's babies to comfort them. And that was a practice that was done in our community for a long time. And I always thought it was funny after, when I learned as a nurse, that your breast milk changes in response to your child. So I thought, what if someone who's breastfeeding a toddler babysat a newborn and breastfed them, and your milk changes? So that was always an interesting question and insight that I had gained. So thinking about that teaching about how we shared breast milk with one another, the women, whether you're friends, cousins, those sorts of things. And so when I think about integrating the cultural practices that I've learned with clinical practice, I think it's helped me to adjust my nursing lens. That at times it's been challenging for me when I had encountered a practitioner that said, well, we don't recommend that, or it seemed like sort of like this paternalistic shared view, rather than being curious and saying, oh, that's different, or, we've heard this, but I'd like to learn more about that. And being open to integrating those beliefs and teachings into their practice. And so I think it's helping me to edge on sharing that with some of my coworkers, friends and family, and hopefully to uphold those teachings in a good way. My grandmother, who is now 97. And so with that, hoping to carry on those good teachings as a woman, as a nurse, and as a pro breastfeeding, as a traditional teaching and practice for our people. Curious to open it up to some questions or comments from the participants today.
I guess I can go first. Do you mind sharing any of your experience transitioning between, because you lived on reserve, and so you had access through health services through a community site, but here in Chilliwack, there's quite a bit of overlap with public health too. And I was wondering, did you see through your experience any barriers or exceptional coverage or lactation support? What was that like for you living on reserve, but urban?
Yeah, and I do refer to our area as suburban because we're so close to town. Like on my reserve here, I can walk to 7-Eleven. That's sort of like my reference, especially when I'm presenting to kids. I say, oh, on my reserve, I can walk to 7-Eleven, get a Slurpee. Some reserves, you have to take a ferry and an airplane. Like they're very far away. And I think when I started practicing here at what we call our FNHSO, Stall Service Agency, there wasn't as good of a connection with the public health unit here. What was interesting when I very first started practicing there, working with them, is that they would forward discharge summaries to us of folks who were flagged on reserve, and quite often they were missed. And so we were trying to look at improving the quality of communication to let them know, well, what were the addresses and roads on reserve by providing maps to them. they also were under the belief that they were not required or they were not allowed to go on reserve. And so there were many myths that we needed to dispel for them, because we had to get a letter from the Indigenous department stating that as Indigenous people, we are citizens that are entitled to service from them, and that our service is an addendum in addition to what they provide. Because we have, you know, as sometimes there's only one or two community nurses, you can't sort of be great at everything. And the bit of breastfeeding training that I'd had at the time, I don't think is as progressive or extensive as the services and supports that are provided now. Like, I remember, Barbara, you were one of our main contacts for supports back then when I was a young nurse, and really being unsure about how do I do this. And I really learned a lot from the moms who were experienced breastfeeders, and I thanked them for that. I know that we were cautious at the time to refer public health to do those home visits, because we were concerned about the lack of cultural safety, as well as many of the checks and balances that they require before doing a home visit, because they would refuse so many of them, or they didn't know where to go, because the directions of pass the broken down car on the left-hand side, take a left where the post is sticking out of the ground, wasn't good enough directions for them. Or there was a broken stair on the step, and so it checked the lack of safety. And I was like, well, if you use your common sense, you could step over it and make sure not to, well, there's a dog there. The dog is friendly. Like, it was just, I thought, you guys are making this way too difficult. We'll go there. And quite often I could tell that the parents weren't happy that that we weren't able to go. Yet I knew I didn't have as much breastfeeding training and support and experience as some of the other folks. So trying to find that balance, like at what point, or we would accompany them if there was an issue with breastfeeding. Quite often they would decline the support when offered. And so that was a challenge as well. What I would feel would be better is lactation consultant support. And so when I had my third child, I had such extensive issues with the latch because my son had a tongue tie, which was interesting. There's so much differing opinions about how to address a tongue tie. Thankful that the physician in the hospital erred on the side of conservative treatment, starting conservative and go from there. Whereas I had heard some other practitioners, and another nurse came into my room and said, oh, we can send you guys here and they'll just laser it off. And I thought, whoa, that sounds like an extensive intervention. And so I thought, I'm going to go down this rabbit hole of asking for as much support as I can, because I really needed it. And instead of having the shame that as a nurse and an experienced breastfeeding mom, I should know how to do this, I didn't know how to do it. I really struggled and did get to the point where I was having the sleep deprivation and dizzy, just not rested. And I ended up having to hire a lactation consultant privately and pay out of my own pocket to get the support that I needed. And financially, that was not helpful. But I thought, I can't not breastfeed. I have to uphold my grandmother's teaching, and also as a nurse, do everything in my power, and also use that journey to inform how difficult would this be if I wasn't as committed. And I was going to like pull the chute, so to speak, to say, I can't do this. I don't have the resources or support. And as someone who's so well supported in breastfeeding, how easy would it be to say, I can't do this? And as we know, different FNHSOs and supports have different levels of people with different certifications, access to that. And unless you're in person, it's difficult to have that latch support or the maneuvering. And I was able to go right to the lactation consultant's home, who actually was a retired nurse that I used to work with. And she was so supportive. And so I think at this point, from what I understand, public health has changed quite a bit from the pressure of creating the Indigenous liaisons, the relationships that are changed and shifted. It was interesting. When I very first started there, they said that they did not go on reserve on the weekends. They would serve everybody else and not do the home visits for Indigenous patients. And I remember I was actually in nursing school at that time, and I was invited to attend the meeting, and I thought, oh, I'm just listening. But then when we got to that point, I said, but why? And they said, oh, well, we're too short-staffed, so we just prioritize the other folks. And I said, but why? And they said, well, they're on reserve. And I said, and I kept questioning it and questioning it. And years later, I remember the senior nurse came back and said, I thank you for questioning that. We didn't understand that that was a racist action that we took. And I said, that was terrifying for me as a student to question you. But it really was horrifying to me because I put myself in that position of being filtered down as last priority because I was an on-reserve Indigenous woman. And so having that strength, and that it's at that time where I like call on my colleagues like this room and think about, oh, it's okay for me to do it in a good way. These folks are standing behind me and supporting me to question this and say, okay, well, first of all, is this the battle I'm going to fight today? And what's the next way that we can connect and say, well, can we carry this conversation forward? And I'd like to question that and see if we can find a solution to shift this narrative. And so I recall that experience quite a bit when you talk about the shared roles and responsibilities that we do for discharge planning and follow-up support to moms and babes, particularly around breastfeeding. So I think about how many folks were unsupported during that time and how much has changed since then. I just see that there's a comment here from Lucy sharing that I witnessed the sharing of breastfeeding with family and other breastfeeding moms in the community. I think it was that everyone had a role and sometimes the mom was busy. I can picture them at the side of the house with the intergenerational life givers caring for everyone's children. Thanks for sharing that. Yeah, I think that there's so many great stories that can come from community about families that have had the privilege of carrying forward some of these teachings about child rearing and that breast milk, chest feeding, breastfeeding, all of those good things are a part of the culture, and how we as healthcare providers can uphold that and create a good space for listening and learning. It was always a goal of mine in our nation to do a research project where we would sit with life givers and those supportive folks, dads, uncles, grandpas, and ask them to share their teachings and document it and do a project to promote and then encourage other nations to do the same. Because I think there's lots of great voices and stories across Turtle Island about this. Thanks, Tony. Any other questions from the group?
I have a question, Inez. I just really wanted to thank you for sharing. When we had this idea for the webinar series, personally, as a lactation consultant, I wanted to hear stories from the community, and so yours has been invaluable. And when you said, you had less knowledge and less experience than the lactation consultants, I feel like I know so little as a lactation consultant because maybe I can help a mother latch, but there's so much more happening. And, it's just one part of that. And so much of that difficulty latching, unfortunately, comes from the medicalization of birth, is my belief. And so as a lactation consultant, I feel like we're fixing those, our clinical work is so much about helping babies breastfeed despite the medical system, and so much of it is the social support and wanting to breastfeed and knowing it's possible and feeling that need and desire to, because your ancestors are holding you up to do that. So I just wanted to thank you for sharing and just say how little I know as a lactation consultant, and I'm so enriched from your teachings today. Thank you.
Thank you, Aiden. I'm so thankful to hear that you're doing this good work of lactation consulting, because we do need your help and teachings too. And having worked with a lactation consultant, I know how invaluable that support can be. And I think at this point in my career, I went from one space, especially as a young nursing, like, I know these things. And then you realize, I know nothing. Then we land at the place of like, I wonder that we could trade knowledge. What can you share with me? It becomes a reciprocal relationship in the practice. And that's where I feel like I've landed in my worldview of Indigenous nursing. I have a little bit to share. You have a little bit to share. Let's put it together, especially when collaborating with patients. And I wonder, for folks that are settlers working in our community, that inviting patients to share with you what they might know or what they're curious to learn if they have, and some folks don't have access to that as well. It's such a complicated issue based on our colonial history, and based on their readiness as well. So thank you for sharing that. It's such a gift. I am every day so thankful for my grandmother, and she's very strict, as well as my aunts and uncles, about the culture and the teachings, but I'm thankful for that because that's how it survived. So thankful for the space to share.
Inez, I'd like to make a comment as well, if I may. My name is Catherine Bartel. I'm also a lactation consultant. And although I'm working now at Surrey Memorial Hospital as an Indigenous maternal liaison, trying to bring some understanding of Indigenous culture and ceremony and a little bit of safety to the birthing experience of life givers there. But I was a public health nurse for 23 years. And boy, you know what? Once a public health nurse, always a public health nurse, right? It's just part of the fabric. It's a challenge because to me, breastfeeding, it's so empowering. And when women feel frightened and disconnected from culture and vulnerable, it's hard to find your power. And the questions that you invite us to ask are such great questions. To me, it's all about staying regulated during the birth process so that it doesn't become medicalized, and then the success is more likely with the breastfeeding. There's just so much interwoven into the birthing experience and the infant feeding experience that lies at the heart of how we feel about ourselves. And that's a big journey. I don't know if there's any quick fixes, but if you have anything any way to speak to that, I would be very honored.
Thanks, Catherine. And I think you bring up an important reoccurring theme that we keep encountering in this work as health educators, as women, as health providers, about the over-medicalization of childbirth, pregnancy, child rearing, breastfeeding being one part of that. And I realized how much I had internalized that from first my colonial upbringing and the experience of, we're on reserve, I'm a status Indian, I'm a ward of the government. Like, that's so weird. I don't know how else to say it. It's just weird.
Yeah.
The only wards of the government are children in care and prisoners. So there's that background experience. But then as a nursing student, I really enjoyed learning about the systems and here's our deliverables and here's what we're going to do. And I really came out of nursing school with like, I'm going to go home and do A, B, and C. And my grandmother promptly put me in my place. And she said, we told you to go to school to fill your toolbox. Your role now is to learn our teachings and figure out how to nurse our way. You're not doing that way. Otherwise, how are you any different than coming in our community as an outsider? And I was very clearly called on that many times. And I remember feeling crushed, like, oh, I'm doing this wrong. But that was such a gift. And so it's really cool to hear other providers, you know, wanting that and feeling that. So as an Indigenous woman raised with this privilege, I am guilty of making those mistakes. Like, that is me being completely transparent, like as a young person, you know, who thinks they know it all, constantly learning, and thankful for those corrections, working with many settlers who mentored me and supported me even in that decolonizing practice, who had figured out ways to best connect with parents, new parents in our community, best practices, wise practices, as they say. And so that was helpful. I do remember, you know, as you're talking about how we connect with people, remembering in my last birthing journey, in all of my birthing experiences, I was always scared. I remember going into the hospital scared. How are they going to treat me? And I have this practice where I don't disclose right away that I'm a nurse, because right away that makes everybody act differently. I have a practice where if I'm showing up to advocate for a family member or a friend in community, I wear a suit. I wear my suit. Yeah. I go to emergency. Chilliwack Hospital is our local hospital here. And if you're not aware, that's where Keegan's case comes out of. And so you have to show up strong. But as soon as you start asking certain questions, right away, they say, "Are you a healthcare provider?" Darn, I gave myself away. But in those birthing experiences, it wasn't until the third experience, because there are many women and families that drive all the way to Abbotsford to give birth rather than coming to Chilliwack, because Chilliwack has such a bad reputation in our community. And I thought, no, I'm going to birth here. Yep, Tony did that. And I remember kind of not being a good communicator with the team, and the nurses picking up on that. And I was on my knees rocking back and forth as my contractions got closer and closer, and I wouldn't let them touch me. And I realized I was going into that place where I was scared and I was going to start fighting the process. And I had mentally gone into this delivery thinking, don't fight the process, because you're going to hurt yourself and you're going to hurt the baby. Because that's how I perceived how my trauma interfered with my first two deliveries. Failure to progress. I had to be induced like 100% with my second, and had some injuries from that. The third time, I remember telling myself, just say how you're feeling. Speak up. I had to like get that inner monologue going, because I knew it would cause a cascade of effect all the way to the colostrum, my milk coming in, all of that anxiety that I was bottling up inside because I felt unsafe. And I had to remind myself, I have the power to say how I'm feeling right now. And I yelled out, I'm terrified you're going to be racist to me because I'm an Indian. And all the nurses stopped what they're doing. And one dropped one of the monitors they were trying to put on me. And they looked like I slapped them across the face. And I said, I'm sorry. I'm just so scared. And we all started crying because I named the elephant in the room. And I said, I'm not judging you, but I just don't know you. I don't know who you are. And they came in and they hugged me and they said, we're going to help you. I said, I've had really bad experiences and I'm scared. And all I could think of was like, is my milk going to be delayed now because I'm so being crazy right now? I'm being crazy. But I was so worried about, that's what I was thinking about. Is my milk going to be impacted because I'm internalizing this pain and I'm not allowing myself to release it? So by this point in my life, I had done so much work to really gain an awareness of my body, my spirit, where the pain was sitting. And it was my commitment to not pass my trauma on to my children. And I told myself it starts at childbirth, and then how I breastfeed my child and allow them to connect, allow my body to produce this magical fluid that feeds their spirit. And if I can't allow my body to do it because I'm allowing this trauma to interfere with it, I can't feed my child the only food that I can offer them. And so I was thankful that those nurses were receptive and leaned in. But I had to take the healthy risk to invite them and share my feelings. It was a traumatic delivery, but I think that by what I did as the patient helped it from being a poor outcome, because my son, they called a code pink for my son. He was stuck. He has a shoulder dystocia and was not responsive at first when they got him out. Thankfully, the blood gases came back good. He had no injuries, just a black face from all the bruising. It might have had to do with the daily Slurpees I was drinking, not necessarily diagnosed with gestational, but a bad habit that I couldn't seem to control. It was very hot that summer. But I have a good understanding now that I danced very close to that gestational diabetes line and need to be very careful. So yes, that over-medicalization that sometimes we internalize and the fear that it causes, opposed to trusting ourselves, our bodies, and our teachings. We've been socialized in colonialism not to trust ourselves and our bodies and to rely on the medical system. So yes, a very important theme.
What a gift you gave those nurses. What a gift you've given us. Did that change the trajectory for you when you shared? Did you feel safer?
I felt that their response to my sharing made it safer because they weren't angry, they weren't upset. They created space to hear me and acknowledge my fear. And then they invited themselves to check in with me. How are you doing? Can we do anything different? Is there anything, they kept checking in to make sure that I was still activating my voice.
Good. Good story.
And so the agency shifted in that moment. And I gave them the agency to uphold that for me because I wasn't giving them that. So I think as Indigenous folks, we don't know when it's safe to hand over the agency to folks to make it safe for us, because most folks have not demonstrated that they are capable and willing. And so inviting, offering that invitation, I hope that you can share with me how I can be best of service to you, that humility, which is the teaching of cultural safety and humility, because I know in the Stala way, humility is held in the highest regard. I want to thank you all so much for joining us and listening today and listening to my story, maybe a bit of a less conventional way of teaching in our space, but I know that we're working to indigenize our space. And I know for me and my family and my teaching, storytelling is a way that we share. And so I hope that a bit of that personal story that I've shared as a nurse, as a mom, and as a human being has inspired a bit of reflection for you in your practice. Thank you for having me. Asian.
Thank you so much, Inez. You're such an amazing speaker. And really, your words are just wonderful. So thank you for taking the time to come and join the Milk Medicine Week webinars. And yeah, it was great. I'm wishing you all the best in your rowing. Do you call it rowing? Am I got the right one there?
War canoe paddling.
Or canoe paddling. Because you're in competition in Hawaii, right?
Yes, not me, but my children. I wasn't
Okay.
in shape when we went to try out, but my two children, they're 15 and 11, will be competing in the
Oh,
worlds.
wow. well, wish them well. And
Thank
I don't
you.
know if anybody else has any more final words to say. Tony, are you wanting to say anything?
I just want to close us out with my deep gratitude for sharing some of your experience with us, and to say that I knew some pieces of your story. Certainly that wasn't a comprehensive overview, but I am honored and humbled to know a little bit more. And I just want to reiterate that for myself as an Indigenous nurse and as a mother, this is someone that I have looked to as a role model, and I'm sure you guys can see why. And so it's return of culture is an extreme privilege to grow up in culture. I did not, but I am grateful to Inez and her family. They do share some with me. And I believe that that is part of a return to our culture too, because not all families were lucky enough to preserve those teachings in those ways. But we're so grateful to community members and families who choose to share some ways that we can carry ourselves in a good way in this world. I'm going to get emotional. I'm just so overwhelmed and grateful. Inez, thank you for your time. I do want to acknowledge that this was an accommodation for us. Inez is supposed to be off on her way to Hawaii for the races. And I knew that this subject is very personal for her, and she's a passionate speaker. And so I was so excited that she was like, yeah, I can make some time for that. That's no small thing for us. So thank you again. And thank you to everyone who attended. Thank you for bringing your most curious selves. It's really a reflection of who you are when you come in for Indigenous Milk Medicine and are open for wherever the day takes us. So thank you again, everyone, in respect for everyone's time. I will close us out and invite any emails or follow-up questions to come into MCH Nursing. So thank you again.
And hope to see everybody on Monday for the next session, which will be Aiden, who will be talking about, what's the title that we gave it now? I've forgotten the title.
Milk, medicine, and substances.
Yeah, exactly. We played around with all these titles so many times. Anyways, so hope to see everybody on Monday and have a great weekend. And again, thank you so much, Inez. And everybody take care.